If you have low back pain, if your SI joint is angry, if your knees have started to complain when you're going downstairs, if your shoulders hate chaturanga, if your feet have some major misalignments and balance is becoming more difficult, you are stuck in some common misalignments. And your yoga practice and common movement cues are probably making things worse. Especially if you're a woman in your 40s and 50s and you practiced yoga for a decade or two, things are catching up to you. But we're going to clear things up. In this episode, you will learn how to align your pelvis for space in your lower back and power from your pelvic floor, how to engage your core in a way that feels supportive and sustainable, how to move your hips to help your knees, how to align your feet so they have strength and spring, how to engage your upper body so your shoulders don't take all the load. Hi, my name's Allison. I've taught yoga for almost 20 years. Some of my students have been with me the whole time. We have grown together and we have aged together. Sometimes I meet people who practiced yoga for years. They loved their practice, but then it started to hurt instead of heal. They didn't have a guide or a way to evolve their practice to meet the changing needs of their body. I'll give you everything I know because I don't want that to be you. Updating your practice can be a little frustrating in the beginning, but it is empowering in the long run. You reclaim your body, reclaim your strength, and reclaim your practice. Here's our plan for today. I'll unpack the common aches and pains, like the low back pain, the SI instability, the achy, cranky knees. We'll dig into the misalignments, the common cues that led you there, and what to do instead. I'll give you a new, clear alignment cue to replace the old one. I'll also show you a demonstration of the misalignment and a quick fix. You can watch or even do it with me. Before we dive in, I have said all of the cues I'm going to tell you not to use. I don't think they're necessarily wrong. I think they're incomplete, or we can do better. The cues I'm going to give you are grounded in anatomy, especially for the female body. If you're a teacher or a longtime practitioner, don't beat yourself up. Learning this knowledge, evolving your practice is a win. It doesn't mean you're behind or you are off track. You're just learning and growing. Sometimes it's your view and not necessarily the cue that is the misalignment. For example, sometimes we get a cue and we do it 120% when you may only need 10%. Here's an example. You're in Warrior 2 and you hear externally rotate your front leg. You may only need 10% for optimal alignment, but you do 120%. It's like you get completely absorbed in that one thing. Instead, you want to fine-tune what you're doing. Adjust just a little bit and watch what happens and ripples through the body. One of my teachers would say, have 70 to 80% global diffuse whole body awareness and only 20 to 30% focused and specific awareness. So in this Warrior 2 example, you hear externally rotate your front hip and you put 20 to 30% of your awareness and focus on that action. And then the other 70 to 80% of your awareness is watching what happens in the body. And then you're able to assess how much is too much and how much is just the right amount to create more connection, integration, and wholeness. Now, 70 to 80% global diffuse whole body awareness and 20 to 30% specific focused awareness is a mouthful. So we have an acronym. We say stay deep, distant, energetic experiencing of the pose or the practice. You want to have like a bird's eye view, a zoomed out experience of what you're doing. This allows you to watch something like externally rotating your hip and assess those ripples throughout the body. We have another acronym, FAR, feel, allow, respond respectfully. So when you do anything like externally rotate your hip, you do that incrementally fine tuning, and you're feeling what happens in the rest of the body. You're allowing it to ripple through the body, and then you're responding respectfully to what's actually happening in the body versus aggressively or from the mind and from that perspective of doing the thing, kind of stuffing your body into the template of the pose. So just as much as I'm going to break down specific alignment cues, remember that sometimes it's your view and how you're interpreting the cue that will create the misalignment in the first place. So misalignment number 1 is butt back, aka confusion about what you're doing with your pelvis. Because of all the time sitting, most of us get stuck with butt back. And then we have common cues that perpetuate that. A cue that has exaggerated the butt back misalignment is press your thighs back, especially in back bends. Another cue that's a little bit tricky is natural curves of the spine. Yes, natural curves of the spine are important and they are structural and they help us get to anatomically neutral. What we see most yoga asana practitioners do is try to get the natural lumbar curve up in the mid-back and the thoracic spine because it's easier to access flexibility there. And that's even more true if the butt is back due to the anterior tilt of the pelvis. Tailbone cues add to the confusion about the pelvis and what to do with your pelvis and how to activate the pelvic floor. And this is especially true in a female body because in the female pelvis, the sacrum tailbone is rocked back. And this is due to the pelvic outlet being larger in order to carry and deliver a baby. For men, the sacrum and tailbone is naturally hooked under. So that scoop, that drop, that tuck of your tailbone is a much smaller movement. For many women to hook, scoop, tuck the tail, it can require quite a lot of movement and cause a posterior tilt, a rounding in the pelvis in the lower back. So you end up in this tuck, don't tuck, thighs back, natural curves conundrum where we're never actually establishing a neutral, stable pelvis. What happens with this butt back pelvis confusion is low back pain, a stiffness and achiness, a grippiness in the lower back, especially when you're waking up in the morning. SI instability and dysfunction, problems at S1, L5, L4 due to that excessive lordosis, that overdoing the natural curve. This tilting of the pelvis also leads to instability at the hamstring attachment, right at the sitting bone. This was a common repetitive stress injury about 15 years ago, so common that it got the nickname yoga butt. Your symptoms might be stiffness, your back going out, feeling crunchy, scrunchy, and low back. To clear up this common misalignment, I encourage you to embrace the alignment cue of grounding your sitting bones down. The sitting bones are where the hamstrings attach. And when you ground the sitting bones down, you turn on those upper attachments of the hamstrings. And it's almost like you drop an anchor on your pelvis. You can think of the sitting bones as like the heels of your pelvis. And when the sitting bones are grounded and heavy, the pelvic floor can have its natural trampoline-like spring. When the pelvic floor is active and moving in that way, other deep core muscles engage, including the multifidi, which are these muscles that run up your spine like shoelaces. They're too deep to feel. They're not innervated, so you're never going to get a sensation of them activating, but they turn on whenever your pelvic floor lifts. Here's the tricky thing. Grounding your sitting bones down will require new awareness. And it's a spot of balance, not sensation, right? Tucking your tailbone under, moving your thighs back, those are going to be much more obvious and sensational. Grounding the sitting bones will also require you to activate and engage the hamstring attachments. And it may take some work to get your hamstrings to turn on consistently. It did for me and many of my students. Watch this or do this demonstration with me. Ground through your heels, bend your knees a little bit. Roll the pelvis forward so your butt is back excessively. Notice how it feels in your low back, at your sacrum. Notice any stories you have around this. And then put your hands on the rim of your pelvis and you're going to ground your sitting bones down. The hip points, the ASIS, will point straight forward like headlights, not up, not down, straight forward. And this tells you that the pelvis is neutral. Notice if you can press to your heels and turn on your hamstrings a little bit. Notice if you feel more spring in the pelvic floor. Notice if the low belly lifts up and in naturally. Pelvis means basin. You can think of it like the pot that the stem of your spine grows up and out of. When your pelvis is well balanced and grounded, your spine can be strong and supple. The next common misalignment goes hand in hand with the butt back, and it's the ribs forward, the ribs flared. When the ribs are flared, they're lifted up and out, and you have misalignment in the diaphragm. This leads to shallow chest breathing, an inverted breathing pattern. You destabilize your own core. You can have symptoms like acid reflux, GERD, indigestion. This will pull on the psoas, which will pull on your low back. A lot of SI instability starts with the rib flare pattern and the displaced diaphragm. There's no way for you to get true core through intra-abdominal pressure when the ribs are up and out. Some of the cues that have perpetuated this misalignment pattern are very innocent. It's what we do when we hear them. We often move from T12, that flexible lower rib region of the spine, and that's when it becomes problematic. For example, chest forward, gaze forward, lean your shoulders back, lean your head back. Most of us will actually break at that lower rib T12 region. So what do we do instead? It starts with your breathing. You want to breathe with circumference, breathe front, back, side to side, and then any alignment principle you do, for example, chest forward, gaze forward, does not disturb the fullness of your breathing, especially the fullness in your back body. For the demonstration and reset, put a strap around your lower ribs. Have it tight enough that you can breathe into it and feel your ribs expand with circumference, front, back, side to side, but it's not so tight that it disrupts your breathing. Now, on hands and knees, extend into cow pose and let your mid-back and your lower ribs collapse. This is that rib flare pattern. And you'll notice that the tissue underneath the strap on the back side of your body scrunches up. It almost collapses like saran wrap. Now, do it again. Don't extend as far. Only extend to the degree you can keep the back body full with your breathing. Once you've stabilized your pelvis and drawn the ribs in and down, the respiratory diaphragm and the pelvic floor can be stacked. And this is how you turn on the engine of core in your body. It will lead to stability for your low back, your shoulders, even your knees and your ankles. This takes us to our next misalignment, which is squaring your hips at the expense of your knees. This is an example of aesthetics, how the pose looks, being prioritized over anatomy, what's going on in the body. For example, in Warrior 2, students were often encouraged to square their hips. For most students, most of the time, that will cause the front knee to drop in towards the big toe. And your knee is at its greatest risk when the foot is planted, the knee is bent, and the knee is dropping towards the big toe. This puts strain on the inner knee where the meniscus has an attachment to the medial collateral ligament, and there's more stress and strain that can be put on the knee joint. Also, in order to square the hips, most students would move from the rim of the pelvis. This is not a joint. It's a place where things attach. When you move the hips at all, you want to move from the legs, from the femur bones, where you actually have the hip socket. This misalignment and misperception can lead to knee pain, knee strain, a lack of tracking. It also limits how much you'll open your hips. So what do we do instead? Rather than move from the rim of the pelvis and try to get your hips square, move from your femur bones, and instead of seeing your pelvis like a block, realize that your pelvis is more like the wings of a bird. The two sides can move somewhat independently of one another. They're always connected, just like the wings of a bird, but they can do a little bit different things. Allow that natural rhythm to occur. Treat your body like an organic structure, not like a machine or a piece of furniture. In Warrior Two, square your hips gently, cautiously, and notice what happens to your front knee. Unless you're really cranking on the hip, it will likely drop in towards your big toe. Now, instead of focusing on squaring your hips, allow your hands to be on your hips, allow your hips to move freely and fully. Instead, focus on grounding through your front heel, bend your front knee, keep your knee tracking over your second and third toe. Let the front hip externally rotate, wrap around. Let the back hip internally rotate slightly. Notice how this feels on your front knee, on your hips, on your pelvis, on your low back. Chances are everything feels better because you're moving with your anatomy, the natural architecture of your body, rather than trying to force your body into the template of a pose and what you think it should look like. When you're more compassionate and considerate of your hips, your knees will benefit. When you try to force the hips into certain shapes, your knees often take the strain. Misalignment number 4 is doing funny things with your feet. This can lead to pain or strain in the feet, a lack of balance over time. This also can contribute to ankle instability, knee pain, cranky SI joints. In particular, I want to talk about feet together. The female pelvis is wider and broader than the male pelvis. There's more variation in the angle of the femur bone. So for most women, most of the time, feet hip distance apart is much more compassionate for the pelvis, for the health of the feet over time, also in order to engage the pelvic floor and the deep core. With the feet together, we are also often taught to lift and fan the toes. And what I've seen are practitioners who have been lifting and fanning their toes for 10, 15, 20 years, and they can't even get out of that pattern. It's put a lot of stress and strain in their feet. Instead, I recommend grounding through your heels and putting some pressure on your big toe mound. And then let the rest of the ball of your foot spread and let your toes settle down. Your heels are like the boulder bones of your feet, so we want them heavy. This is where the weight from your leg bones transfers. The big toe mound is very important. It's almost like a caterpillar that when you step, it reaches and then it tensions the arches of the feet. This is what gives you spring, and it also reduces the amount of pressure that's going up to your knees and your hips and your lower back. So we want the big toe to be agile. And when the big toe reaches, it then presses and propels you forward. The big toe is a place where we often see arthritis over time because it's not used appropriately and because of weakness in the upper inner thighs and pelvic floor, misalignments in knees and hips. So all of this starts to come together. In order to preserve the integrity of the big toe, yes, you want to fan your toes, but you also want them to come down. And you want that equal pressure at the big toe mound and then kind of that dexterity and push off from the big toe itself. In the yoga tradition, things like the big toe grip were meant to strengthen the big toe joint and the arches of your feet. So here's our fix. Stand with feet hip distance apart. Rock back into your heels. Rock forward into the ball of your feet. Lean to the right. Lean to the left. And then balance your weight front, back, side to side. Get a little bit heavier in the very center of your heels, as if you're pushing a thumbtack down with the center of your heel. And then press just a little bit on your big toe mound. And when you do those two things, there will be a sense of spring in your feet, but also groundedness. We want and need both. Your feet are the foundation of your body. When they're well aligned, when they're sensitive, they have that spring and stability. It contributes to the alignment of your whole body. Final misalignment is overusing the shoulders, especially the rotator cuff and the trapezius, instead of power from your upper back and core. This leads to rotator cuff injuries, frozen shoulders, stiffness, tightness, and upper back and neck, but it can also lead to a sense of disempowerment, a feeling like you can't do certain things, or it can travel down through elbows and wrists. Common cues that let us here are bend your elbows to 90 degrees, lower your shoulders to the same height as your elbows, push through your hands, squeeze your shoulder blades on your back. A lot of cues that create confusion about what to do with the upper back, what to do with the shoulder blades, and how that transfers through our arms. The good news is when you have a stable pelvis and your ribs are in and back, then you have core strength. And then your shoulder blades just settle onto your rib cage. When your shoulder blades are on your rib cage, you can reach from your upper back through your arms, and you have the power of your whole upper body behind you. You're not going to over recruit the small rotator cuff muscles or use the upper traps to do everything you need to do with your upper back. So instead of bending the elbows to 90 degrees, instead of lowering so that your shoulders are parallel with your elbows, you want to bend the elbows just a little bit. Anytime you're doing anything with the arms, you want to breathe with circumference, fill up the back body, and then feel like whatever you're doing with your arms is coming from the shoulder blades that are on the rib cage. I know that's a lot to remember, and it sounds like kind of maybe a bunch of cues all together, but to simplify, you want to feel like your arms are wings extending from your upper body. Here's your reset. Come onto hands and knees, and you're going to push the floor away and round your upper back. And then sink your chest to the floor and squeeze your shoulder blades together. Do that a few times. It's almost like a cat and cow with just your upper back, just your shoulder blades. And then I want you to find a sweet spot. Breathe with circumference. Use your breath to fill up your ribs behind and underneath your shoulder blades. And then there will be a sweet spot where it feels like your shoulder blades are almost pinned onto your rib cage. And then it's like from your upper back, upper body, you reach through your arms. Maybe even lift into a plank from here, but don't change anything about the upper back, upper body. Maintain your ribs back, your stable pelvis, and reach through your heels. Do you see how it's coming together? So let's wrap up. If you've got aches and pains, you feel like they're coming from your yoga practice, yoga doesn't feel the way it used to, it's time for an update. Your body is changing and your practice needs to change too. The most common misalignments I see are butt back and confusion about what to do with the pelvis. The fix is ground through your sitting bones. You know you've got it when there's a little bit of tone at the hamstrings, your pelvic floor has more spring, and your hip points are straight forward like headlights. Number 2, rib flare. The ribs are lifting up and out. Draw the ribs in and down. Breathe with circumference, front, back, side to side. Keep the back body full, especially during back bends or when you're tempted to collapse in that mid-back, lower rib region. Misalignment number 3, square hips at the expense of your knees. The fix is move from your femur bones and your hip joints. Remember that your pelvis is more like the wings of the bird, not like a square block. Number 4, confused feet. Feet hip distance apart is better for most women most of the time. You want to ground through your heels, they're the boulder bones of your feet, and have dexterity and agility in the big toe mound. Number 5 is overusing your shoulders, especially rotator cuff muscles and trapezius. The fix is fill up your back body with your breath, get the shoulder blades grounded on the rib cage, and then you use your upper back power for anything you do with your arms. These alignment principles ask you to build a stronger relationship with your own body, which will take some work in the beginning. It's not only a shift in how you're moving, but even how you're seeing your body, what you're asked to sense in your own physical form. But once you get over the learning curve, maybe a little bit of frustration in the beginning, it is empowering. It'll enhance your inner listening, inner knowing, and your confidence in your practice and your movement. If you want help mapping these onto your body, I work with people one-on-one. Use the link below to schedule a call. Thank you for being here. Thank you for your willingness to learn and grow and evolve your practice.